Amazing. So, Gurinder, thank you for being here once again.
Thank you for
Can
having me.
you tell us a little bit about yourself, how you've come into doing what you're doing, the story behind it?
Yeah, sure. So in a little bit of a roundabout way, I'm actually an economics grad from university, and I thought I'd follow that line. Went into accounting and finance when I left university, and then became a tax analyst for nearly 3 years at um, a multinational corporate entity, and was doing that. And I was like, yeah, work is great, but there was just something that just wasn't resonating with me about it. And when I figured out what it was that I wanted to get in the fitness industry. I wanted to help people live better, healthier lives. And then I realized that, and I thought, okay, that's what I'm going to go for. So I kind of I left that world, and then made my way into the health and fitness industry. And then when I got there, I realized actually I like looking at things a little bit differently than somebody who you might associate with being in a gym who's going to just smash their clients, beast them, and and then just give people that kind of like hard workout that they're looking for. For me, it was a lot more about problem solving. Why do people have the kind of issues that they experience with like posture and pain and stuff like that? And when I ran with that route, I started working out in a commercial gym, and then after that, I realized that I wanted to go further down this line. If I wanted to do that, I'm going to need to find somewhere which is a bit more niche for it. And thankfully, I had the opportunity to work at a chiropractic clinic with other physiotherapists, massage therapists, osteopaths, and other rehabilitation trainers for about 4 years, and where I just kind of honed that aspect of things a little bit more as well. And I just saw, and I class myself as a lower back rehabilitation coach, because there's plenty of that problem that's going around, and there's a lot of misunderstanding about how to overcome that. And so I kind of saw a lot more lower backs in that space, and I realized, okay, I've seen most of this. I work with the whole body holistically, but this is what I saw the most of, and I figured this is the line that I'm going to go down. And then fast forward a few more years, here I am, calling myself a lower back rehabilitation coach, and just helping people with back pain, and primarily with back pain, although I see like necks, knees, hips, and stuff like that. To help them on the journey out of that chronic or recurring issue that they've had, because it tends to go on for too long for the kind of people that I see. It's not an acute thing. It's something that they've had for a minimum 3 to 6 months. People have had the kind of people I see have had issues for 25 years. A lot of the case, a lot of times as well so it spans that breadth of time. And so I decided, yeah, that's what I want to do. That's what I want to help people with. And so I've been doing specifically since like 2014, 2015.
Wow. I love hearing how you've come into it, starting off in something completely different and then
Yeah.
following that intuition.
Yeah.
It's really important. And I'm sure that, gives you that passion I can definitely see when you're talking about it.
Mm.
It's, something that you're really, really interested in.
Yeah.
I
Yeah.
know that's really important actually when you're finding side note, when you're finding a practitioner, someone you want to work with, it's that they're really, really interested in what they're doing,
Yeah.
have a curiosity for it.
Yeah, yeah, absolutely. And just like, just caring about what's going on with the other person as well. It's like, I actually got asked recently as well, like somebody who was worried about, working with me because they've seen so many practitioners, is like, I don't want this to be a cookie cutter program. And because that's the feeling that they've got previously. And I was like, look, no, this is all based on what you're presenting to me. So yes, the human body has some principles that we need to fulfill for everybody, and that might look the same, but the way we do it for you is going to be a different approach depending on what you're going to need for your specific circumstances, and what you resonate with the most. So so it's always important that people realize that they have somebody who cares about cares about their progress, and make sure it's about them, and it just helps guide you through that process, because it does take a little bit of time to make sure that you have all the tools under your belt and skills that you need to make sure you stay and feel good in your body, get that confidence back.
Definitely. I'm really glad you said that actually, because there can be a feeling amongst patients, even of a rare condition like MEN1, we are together, a lot of us experiencing similar symptoms, but even within that experience, there's something so unique about what we're all going through. And I think yeah, sometimes the cookie cutter approach just doesn't work. What works for one person is not going to work for another. So I'm really glad you said that, because I think for people listening who might be going out there, wanting to find someone to work with, as you say, someone who actually really cares about their individual experience, whatever the label is, whatever, the complaint might be, I think is really, really important.
Yeah, and like in your world and in my world as well, you might have seen it where people can present with almost exactly the same symptoms. And for me, it's like, somebody would take their finger and point at their lower back and go, I've got a problem here. It's like, okay, cool. Let's take a look at how to resolve that problem. And for one person, it might be like, you need to work on this set of movements. And for another person, it's like a completely different set of movements, because the way that their body is holding itself up is completely different, even though symptoms present the same. So that's always important to kind of like hit home and understand. Is like, people generally ask me, is like, what can I do about this? I was like, I don't know until I assess you. It's like, I can't give you a very specific thing to do for you, because I might just miss the mark completely unless I've actually assessed what's going on. So yeah, it's definitely an important thing to take into consideration with what you said there.
Hugely. So when I did come to see you, I obviously had pain in my lower back, but that my lower back wasn't really the source of the problem necessarily. And as we know, or as I have come to find out by working with you, where we feel the pain or the tension, the discomfort, whatever it is, isn't necessarily the root of the issue. And I was aware, I'd had this massive surgery, but I didn't really contemplate how that was necessarily going to be affecting my body going forwards, because I think I just assumed that, it would all work itself out and, I wouldn't have to worry about it. When, if you've worked with, obviously you worked with me in the past and I've had surgery, and you've worked with other patients who've had, major kind of trauma to the body like that, what is it that they kind of might not know about how that surgery has affected their body, their muscles, ligaments, tissues, tendons, all that sort of thing? And then, for example, with me, I just came up into a pose one day in yoga, and that was it. My back was like, whoa, I don't like this anymore. So yeah, with what is it with surgery that kind of can cause those sorts of problems to happen?
Yeah, so you put it right. It's a trauma. Right? It's a trauma to the body. It's just we don't notice it because we're going to be under anesthetic, and so what happens is the body, the movement that your body displays is governed by the nervous system. So if you're going to create an incision in the body, that is like having a trauma. So cut your finger is like you've got some level of trauma there, for example, and the effect of it depends on the kind of importance and the weight that the nervous system puts on that particular trauma. So when it comes to big surgeries, that can have an effect on have the effect on the body to essentially, like, let's go with abdominal surgery, because that's what might happen for a lot of patients with MEN1. Is you're cutting through the abdominals, which is like the center essentially around the center of mass of the body, and when you're making that incision and you going into that region, you're potentially interfering with how the muscles and the fascia and everything like that is communicating with the brain, which means that your movement can become like disorganized, is a word that I would use, because the muscles don't know how to coordinate efficiently around the area. And so there needs to be some corrective work to be done, especially if you start to experience pain symptoms and you get this sensation of disconnect with your body. You can get people, especially like C-sections, for example, where they've had an incision going across the whole lower part of the abdominal, and they feel quite like two different bodies. Like they feel like their lower half is disconnected from their upper half of their body. So if you get sensations like that, you start to experience pain post surgery. It could be back pain, like you had. And then it's like, okay, I've experienced this trauma in the body. I've potentially got these scars, and they might need work. So you might need to work on the scars specifically to be able to help you, create a better communication between brain and body again. Because, like I said, it creates an interference in how the muscles around the region of the scar are communicating with the body. So you want to see if that's not you want to assess and make sure that the scars aren't creating that kind of issue. So yeah, when you've gone through something like that, you want to you want to look at all the consequences of that surgery, not just what happens with the surgeon and the consultant, because there's more to it than just, okay, you've had your surgery, we've sorted that problem out, and then off you go. Just make sure you let the scars heal. It's like, okay, cool, I need to let scars heal, but then I need to check on the potential effect that this surgery has had on the way my body functions, and especially from that, how I move my way through life, kind of thing, pain-free, and it's just always worth checking out on that front. So that's the kind of thing that can happen when you're experiencing, when you've gone through something like that.
So you mentioned, because obviously my experience was surgery around my abdominal area. Another major surgery, or I say major surgery, another one of the very, very common surgeries in MEN1 is around the neck because of the parathyroid glands. Obviously, to me, as a lay person, I might think, well, a little bit of surgery around here with a tiny, tiny scar, which it is at the moment now because of the technology, I don't really, that's not going to give me, too much of a problem. Is that kind of a naive way of looking at it? Actually, is there going to be some damage done there? And is that an area to look at as well?
Yeah, it's not necessarily naive. It's just that you don't know, right? You're not aware of it. But yes, so even if the technology is getting better, and these incisions are smaller and smaller, and they're a lot more precise, that's fantastic. But again, because it's something that's an incision has been made into the body, you want to check in on the potential effect of that. But then not just that, because you're having surgery in a region which is pretty sensitive for the body, places a lot of weight around the throat area, then in terms of sensitivity, then you also want to check in on, the effect on your overall function for that as well, not just around the neck region, but for the rest. So yeah, it's definitely again something that's worth looking into to see if it's going to be a thing, and then you can get the all clear. If it is a thing, then you end up having the right kind of work that you need to do to help you overcome that as an issue. And if it isn't, then fantastic, because it just basically, like I said, it just kind of depends on whether there's going to be weight placed on that by your nervous system, or for how big of a thing it's going to be for you to need to overcome or need to deal with. But yeah, absolutely worth looking into.
Okay. So yeah, and we talked before about the impact not just around the area of of the incision, but in the rest of the body as well. And it's been I've heard it referred to as the chain effect. So I know you mentioned briefly before common areas being neck, knees, and hips. Not so much necessarily with surgery, but just general kind of problem areas in the body. And I suppose if a patient with MEN1 is thinking I've got problems here in my hips, but that's nowhere near my abdomen where I had my surgery, or my neck where I've had my surgery. I suppose is it about bringing awareness to that chain effect and asking people to understand that as we kind of said at the beginning, where we feel the pain is not necessarily going to be the source of the problem, and in that case where do people go in terms of getting help for it?
Yeah, so going back to definitely you want to hit home the idea that the body works as a unit rather than in isolation. So you will whatever's going on in one part of the body is going to have an influence on another part. If I'm using my left hand, then something has to facilitate that to happen. It's not just that my left hand is moving in isolation. There's things going on from the elbow to the shoulder to the neck to allow that to happen, for example. And so these kinds of compensations can arise in all these multivariate kind of ways because of how the body communicates with itself and how it operates. So yeah, absolutely, it's definitely understanding that your body is working as a unit, and it's no thing works in isolation. And so even though it intellectually or doesn't make any sense, that's okay, I have something in my neck which is influencing how my knee feels. But when you start to understand how the body actually works through movement, then it's not such a far cry that this could be a thing. So absolutely want to do that. And the best practitioners I've ever come across who know how to deal with this are NeuroKinetic therapy practitioners, NKT. And that's what I practice as a modality that I use, because they're hot on basically whole finding out movement dysfunction at the core of the movement system, how the central nervous system is communicating with the peripheral nervous system. So how, your brain is essentially communicating with the rest of your body, and tapping into that on that neurological level to be able to make the change that you need to see and feel in terms of how you control your body. Because ultimately, as I've said, the nervous system is governing movement. So if we can tap into on that level, then that's where most change is going to be able to be made. So, and those are the kind of people who, at least in my experience, and the ones I'm aware of the most, are the ones who are really, really good at helping with issues like this.
Really good to know. I think some clarity around, feeling the problem, having the problem, and then finding the solution, I think is super duper helpful.
Yeah.
So many years ago, if I'd gone to the GP and said, I've got this issue with my back, I'd probably have been told to rest and just to make as little movement as possible. I think we all know now that that's probably not the best thing for us. And I was wondering if you can explain why keeping fit, active, and moving is so important for avoiding a lot of these common problems, whether or not they've necessarily been caused by surgery, because it's not always the surgery that's the kind of primary, cause. That might just be an aggravator, if that makes sense.
Yeah, no, absolutely. Yeah, like I said, you only know by assessment if it is what is the primary cause and what's the aggravator. But yeah, I mean, it's not years ago. If you went to the doctor and they'll just tell you to rest and prescribe painkillers, is happening all the time right now as well. So it's basically a big chunk of the medical system which doesn't really understand what needs to happen for somebody to overcome back pain, or rather, the system isn't set up for people to overcome it in a fashion which is going to help them. So there's like a massive chunk of the recovery process which is missing for people through that. And but to answer your question about why do we need to keep moving, why do we need to stay fit to be able to help us overcome these kinds of problems when it comes to let's say back pain, then but essentially it comes down to two things, and how I boil it down to is like it's movement variability and movement capacity. So what I mean by variability is having your body have the options to be able to do lots of different things. So when you are capable of making lots of different kinds of movements, your brain feels safe allowing you to make those kinds of movements. And so and because what pain is essentially, it's a warning signal, it's a signal for change. Your brain just like essentially says, I don't like what's happening here, and I'm going to protect you. And to protect you, I need to create pain so that you stop doing that thing which makes me feel unsafe. And so if you have more variability, so you challenge yourself in lots of different kinds of ways, like, yoga, what you practice, is a fantastic way of putting your body through lots of different positions and movements so that your brain goes, oh, I can do this, I can handle this, it's fine, so I won't create any pain. So that's really important. So you want to do things which which allow you to express your this meat vessel in as much variability as you can. So it could be walking, it could be doing martial arts, it could be doing yoga, it could be climbing, whatever it might be, whatever floats your boat. So you want to do that as often as you can. Then when I say capacity, that comes down to building up a bigger and bigger and bigger threshold before pain ever becomes a thing for you. The best way to do that is to build strength. So you want to build strength in all the very, very various positions that you will put yourself in. So you feel safe, and your brain feels safe that, I have a lot of capacity here, I can do this, and I can keep doing this without feeling like I'm going to fall apart. So essentially it comes down to those two things for me, where you express your body enough in lots of different positions to be able to feel safe making lots of different kinds of movements. And then also you build strength on top of all that variability as well, so that you can have the capacity. And then again, your brain feels even safer because you have a ton of strength to be able to handle the different stresses that life throws at you, and the different challenges that you might want to put your body through as well, especially if you like being active. So that's why it's so important for you to try and stay fit, try and stay healthy. I mean, we could talk about it in lots of different kinds of ways as well, but when it comes to being pain-free, those are a couple of principles that you want to understand, and that's why you want to stay fit and healthy and active.
I'm really glad you said that, because I think there's this preconception that in order to be really fit and healthy, that you have to go and do those very classic things like become a long distance runner, or start doing triathlons and all that sort of thing. And actually so much of it is about what you enjoy, and also how your body feeds that back to you. And as you say, variability is really important. So if you like walking, absolutely great, but what else is it that that you can do that's gonna I suppose support your whole body in its needs. So I'm glad you said that. When we go into, as MEN1 patients, when we go into appointments with high calcium, called hypercalcemia, and we're discussing options and things with our doctors, our consultants, obviously their kind of initial response would be to manage it with medication or surgery. They do say in their defense, there are a couple of things you can do yourself which are going to massively help your bone health. Two of those are keeping up our fluid intake and weight-bearing exercise. Obviously those probably aren't necessarily given the same impetus as they could be. And I wondered, in terms of bone health, because things like osteoporosis, osteopenia are kind of a given for a patient with this condition, how is it, for those of us who are curious, how is it that weight-bearing exercise helps to keep our bones stronger?
Sure. So basically, when you are doing weight-bearing exercises, I'm going to use a squat as an example. Some people might know what that is. It's like, you basically bend your knees and your hips, you go down, you come straight back up again. But imagine you've got a bar now on your shoulders and you're trying to lift an extra load as well. And it doesn't have to be, it can just be your body weight to start with, depending on where you're starting from. So every time you do that, every time you create movement, your muscles are pulling on the bones and joints to make those movements, pulling on the bones to make those movements happen. So every time you create that mechanical tension, when it pulls on the bones, it's creating a bit of stress on the bones. And big stress is a bad thing. Stress is not a bad thing. The dose is the poison. So stress is actually very good in this situation, because what it actually ends up doing is encouraging the bones to grow stronger tissues. So when you've got the muscles pulling on the bones are being put under stress, and then the signal is like, okay, I'm under stress, I need to make sure I can handle this stress. So it's going to lay down new bone tissue and make you stronger. So that's why doing weight-bearing exercise is super, super important. And I cannot harp on enough about the benefits of strength training as well, even when it comes to like longevity, even if it comes to brain health as well, because it's probably the most effective way to improve a lot of those markers of like feeling good in your cognitively, feeling good emotionally, feeling good physically. And like I said about variability and capacity, building that variability and capacity is by doing movements under load. And so I would 100% suggest that for sure. Obviously, follow the advice of your physician, given the complications that you might have with MEN1. But if their advice is do weight-bearing exercise, then take that as far as you can. Basically, there's no substitute for it, and you will not regret it.
Absolutely. I think it's giving those what seem like low-level suggestions, exercise, water, all that sort of thing, giving those the same legitimacy and importance as the more radical things like medication and surgery. And ultimately, it's those things that are within our control. There's a lot that's not within our control necessarily with a condition like this, but I found personally to put focus where I can have an impact is really important. And if weight-bearing exercise is one of them, going to keep doing it.
Yeah, absolutely. It's like, do everything you can in your own power, right? Because that's what's going to make you feel good too. It's like a twofold effect of firstly is like, okay, I'm doing what's good for me, which I know is going to help me, and that's going to make you feel physically better. But just the action of doing something which is beneficial for you makes you feel better about yourself as well, and that like helps you helps you deal with whatever you're going through as well in a much better way. Because if you feel like you have agency, that in and of itself is going to make you feel better. But if you don't feel like you have it, and it's a bit of a downward spiral from there. So you just do what you can, and that's going to help you feel good in your body because you're actually doing that thing physically, but also knowing that you are taking that action is going to have that the extra benefit of like helping you out mentally as well.
I couldn't agree more. I actually couldn't
Mm.
agree more. Brilliant. I honestly could ask you questions all day. I feel like you've got so much knowledge and expertise to share. And I wanted to say thank you because, as I say, this is not a kind of conversation or discussion that's really happening at the moment for patients with this condition. And I know the experience I've had and what I've learned that I didn't know before. Basically, as a result of meeting you and working with you, I just thought, how can I bring this to people? How can I introduce that so that they have options going forward? And I think what you've shared has been absolutely invaluable. So yeah, a massive thank you for your time. And
Thank you. Yeah, thank you for having me.
thank you. Oh, one more thing. If people want to reach out to you, how do they find you?
Yeah, Instagram would be a simple way. So they can find me at Gurinder Sandhu Coaching. So it's a bit of a mouthful, but if you have show notes, you probably can whack it in there. So it's simple. So I'm available. You can DM me. So if you have any questions, you have any concerns, or if I can help you in any kind of way, just reach out to me, and I'm happy to help however I can. So yeah, that'll be the easiest way to reach me.
Brilliant. Thank you for that.
Thank you.